So a couple of things to discuss in this morning's update. Here we go. The first thing is just a snapshot of where we are right now in terms of disease transmission. As you can see, as of yesterday, reported slightly under 1,000 cases. So we're at a rate of about 50 cases per 100,000 per day. Obviously, good that we have seen a significant decline in transmission and case numbers since the middle of November. But you can also see that we've really appeared to have plateaued and potentially even started to have an upswing over the last week, probably a reflection of events over the holidays. And I think that's something that will continue. Also important to note that the rate that we're experiencing, 50 cases per 100,000 per day across the state, is where we were right at the end of October, which at the time we thought was a horrific number, which indeed it is. And so important to keep all of those things in context, especially as we are preparing either have sent kids back to school or preparing to open up schools for more in-person learning. Also important to note where we are with hospitalizations, again, dramatically decreased from what was close to 1,000 inpatients from COVID in the middle of November, but again, seem to have significantly slowed in terms of decline over the last week and potentially seeing a plateauing effect as we are with cases. And then with deaths, as we've seen, our number of deaths on average has been going down, but still at a very high number compared to where we were earlier in the fall. And we are approaching now 1,000 deaths per million, which is, I think, a very grim milestone for us. Other issues that I think highlight the risk of a resurgence of cases and the effect of post-holiday transmission are positivity, percent positivity, which has gone up certainly over the last couple of weeks. Statewide and in the test over test method, as we see here, and also from aggregated data from counties, which uses more of a person over person. Both of those are showing increases over what's happened over the last couple of weeks, or over the few weeks before that. I spoke a little bit about the return of schools, and I think this invites some additional retrospective analysis of the impact of schools and both primary and secondary education and higher education on transmission in communities. And there's been some additional work that's come out of analysis of the fall wave that's helped to provide some insight there. This was a paper published this week in MMWR that looked at transmission rates in roughly 100 counties in the US that house large colleges or universities. So that was classified as colleges with a enrollment greater than 20,000. And they found of the 133 total, they had 101 that had sufficient data to analyze and whose classes started during the period of analysis that they needed to. And when they looked at comparing counties that hosted large colleges that went back with in-person learning versus counties that hosted colleges that went back with virtual online learning, and compared that to colleges or counties that did not have a large college or university, they found pretty consistent trends. As you can see, 2 weeks before college started, again, these counties dramatically increased their testing rate. Probably reflects increased concern about the prospect for transmission with students coming back, and that resulted in a corresponding decrease in percent positive. But then what you see is right as kids start to get back into the area, preparing to go back to campus with the start of classes on day 0 there, you see that percent positive suddenly takes a swing north. And this translates a couple of days later into increased case reports. And so what you see is counties that hosted colleges that had in-person learning saw a dramatic over 50% increase in documented cases that occurred within the 21 days after college resumed versus the 21 days before classes resumed. And you compare that to counties that had no colleges or only remote-only colleges that both saw significant declines in case counts from comparing after to before. And this obviously excludes many of the asymptomatic cases which did not get tested during this period of time. So pretty compelling evidence, and this reinforces what we've talked about and examined earlier, that college campuses appear to be, epicenters for transmission, not only with the population of students, but also the population of folks across the counties in which these colleges reside. The second paper that recently came out that I think is important to look at is an analysis of 131 countries and non-pharmaceutical interventions that were implemented in the spring, and looking at the effect on transmission and calculated R values early in the pandemic between January and May. And this analysis found, again, pretty compelling evidence that 3 non-pharmaceutical interventions held consistent impact in reducing R value most significantly. And those were limiting gatherings, particularly limiting gatherings of 10 people or less. And you can see from this graph on the left, this is percent reduction in R associated with implementation of these NPIs. The second NPI is closing non-essential businesses, and these were particularly high-risk non-essential businesses. So those were face-to-face businesses such as bars, restaurants, and gyms. And finally, the closing of schools and universities together. The 2 most effective were gatherings of 10 or less. That was a reduction of 42%. Closure of schools, which is a reduction of 38%, and then closure of these high-risk face-to-face businesses, 27%. When these were implemented together, they had a dramatic reduction in R value and were able to reduce R value to less than 1, even when R value in the community at large before interventions was well above 3, which is above what we've seen in almost any community transmission modeling that has been done. So again, not surprising, reinforces what we've talked about: limiting gatherings, eliminating high-risk face-to-face interactions in the community, such as indoor dining, bars, clubs, gyms, and closing schools, are the 3 interventions that consistently worked and seem to give the highest impact. So as we are moving forward into the height of epidemic transmission, at least across the US, we're at a starting point now compared to where we were in the beginning of September, when schools were going back into session after summer, where we are many times the community transmission rate of what we were. And so the risk is even higher as we're sending kids back to school. We have essentially eliminated all of the bans we had on gatherings and those high-risk face-to-face businesses. So I think that without interventions to reverse those, we are going to see increased transmission coming up over the next several weeks. So that's all I got. Happy to answer any questions.